Welcome back to Zotec Answers, the podcast where we break down the policy, technology, and reimbursement issues shaping the business of healthcare. In today's episode, Ed Gaines, Vice President of Regulatory Affairs and Industry Liaison, and Henry Eisenberg answer the question, what were the key takeaways from EDPMA's recent day on Capitol Hill? Together, they discussed the dozens of EDPMA members who met at Washington, D.C. on June 10, 2026 for briefings on key industry issues, work on advocacy strategies, and meet with congressional representatives to advance emergency medicine priorities. All right, good morning. I'm here with Ed Gaines, and today we're going to be discussing his trip to Capitol Hill with EDPMA. So good morning. How are you?
Good, Henry. How about you?
I'm pretty good. World Cup's on. U.S. plays tonight. That'll be a fun watch. So excited for that. Are you a soccer guy?
Who are we playing?
We're playing Australia.
Okay.
The Socceroos is what they call themselves.
Do you fancy our chances?
I do. I think we're better, but I don't know. They're good defensively, so it should be a good game. But yeah,
All right.
I'm excited.
Good.
All right. So to start things off, I did a little background research about you and about EDPMA, and first thing I noticed is that you have a background in law, that you're a lawyer. So
Yes.
what interested me was what made you kind of want to start EDPMA and get involved in helping emergency physicians, and how has your experience in law actually helped to benefit your impact on these physicians?
So what brought us together as a coalition of emergency groups and revenue cycle companies back, it was 29 years ago, was a regulatory issue having to do with independent contractors. Emergency medicine then and now has a significant cohort of doctors that have a private practice. They work as a family practitioner, they work as a pediatrician, particularly in rural and underserved areas. And many of them have had training in the emergency department. They may not be full-time emergency docs, but they like to moonlight. It's kind of the classic moonlighting situation. So they're in a IRS status called 1099 or independent contractor. They already have their own practice, but they want to work on a part-time basis. Anyway, so there was a technical issue that CMS had interpreted to limit who could receive the payment for those services. And a lot of the ED groups at the time, the larger groups, had independent contractors. So that's kind of the crisis that brought us together. We formalized the organization in 1997. I was one of the co-founders. We had physicians, we had non-physicians, and the organization has always had really strong physician leadership. So it was that technical issue to get started with, Henry, but today our mission is really two things: advocacy for emergency medicine physician groups and supporting organizations like Zotec Partners, who provides revenue cycle services, and education. So we have kind of a two-pronged mission. We have a number of different committees that try to fulfill that objective. And this lobby day that we had was led by our chair-elect, Dr. Jen Raley from Wake Emergency Physicians. And Jen is also the president of our PAC, so our Political Action Committee. So we had a PAC event for one of the members of Congress, Dr. Joyce, who's a physician from Pennsylvania. And then we had a full day on Capitol Hill. And we really had kind of three main objectives to talk about. We wanted to talk about the No Surprises Act Enforcement Act, H.R. 4710, which has been introduced in this Congress. It was introduced in the prior Congress. Number two, we wanted to talk about the Provider Reimbursement Stability Act, H.R. 8163, which has already passed the House Ways and Means Committee, unlike the 4710, which has not yet passed. And then a bill that has either been submitted or will be submitted in the near term, and that's called Affirming Continued Access to Essential Safety Net Services, or the Access Act. So those three, either bills or proposals, were the main thrust of our meetings. And typically what you do in those meetings is you try to, with a staffer who would probably be like in your age cohort or thereabouts, and they may be a legislative assistant, they may be a policy director, they may be a health legislative assistant. So it all depends on kind of what committees. There are two principal committees in the House that have jurisdiction for Medicare, Medicaid, and HHS, and that's Ways and Means and Energy and Commerce. There are Education and Workforce also has some involvement. There's really one committee in the Senate. There's kind of one and a half, I would say. the Senate Finance Committee, and the Health Committee. So if you're talking to staff of those committees, they're typically very knowledgeable of those issues. So we had a combination of physicians and those of us that are in either practice management. We had a practice manager here from North Carolina and myself. So we spent the day on the Hill. And I think we made some progress.
Okay, so when you go to the Hill, I know you're based in North Carolina, correct?
Mm-hmm.
Sorry, I know I just asked you a question right
It's
when
all
you're
right.
going to drink.
It's okay.
But so when you go to the Hill, are you focused, what legislators are you focused on, like from which states? Is it just North Carolina or is it a wide ranging states?
So I think we had over 45
Oh, wow.
members
Okay.
of EDPMA on Hill Day. So we had congressional offices from California to New York, Florida to Michigan and Minnesota covered. I think we did a total of like over 60 meetings, including committee staff. So my group was the North Carolina delegation. So we
Okay.
were meeting with House members from North Carolina and our two Senate offices. We weren't unfortunately able to schedule with one of the Senate offices, but we did meet with the other one. So, and part of that is just to kind of lay the groundwork for who we are. In some cases, we've been meeting with members of their office for years. They kind of know what our issues are. So it's a higher level discussion. And in some cases, you have a representative who either may be new or has new staff that really needs to kind of start from the basics and go up from there. And we have folders that we leave for them. We have a little leave behinds. And we try to do like a 1 or 2 page document that kind of summarizes exactly what our position is on the various bills. And then you just try to engage them in question and answer and try to understand from their perspective, what do they see happening in kind of the House leadership, the Senate leadership, what bills might be moving. Most of these bills that we contend with, Henry, are not standalone bills. They have to be attached to something else. So the way we say this in Washington is, what's the vehicle, right? So it's like you're jumping on the bus. There's a bigger bus, and you've got to figure out what bus you're going to jump on, right? Because these bills need to be attached to something that's going to hopefully pass. Typically, this time of year and maybe after the midterm elections in November, we're talking about what's called a reconciliation bill. And reconciliation bills deal typically with funding. So funding related matters can be attached. They can jump on that bus. Non-funding related matters typically can't. But that's what we're after. So part of it is kind of getting their inside baseball on what do they think is moving, when do they think it's going to move, if it's going to move, and trying to give a little oomph to the process.
Mm-hmm. Okay. And then just one more question. So I was looking at the website, EDPMA website, kind of about, I saw you in a section about the trip to the recent trip to Capitol Hill. And I saw that one of the goals of the trip was to, quote unquote, work on new advocacy strategies. So as an advocate myself, I'd be curious about some new advocacy strategies that will help Zotec and to help diversify advocacy initiatives.
So one strategy that we've deployed, I think, effectively over the last few years is how to use our members' data. And Zotec was a big part of this last year when Emergency Medicine did a study, a multi-year study of just where emergency departments were in terms of how they're being reimbursed and the declines in reimbursement, both government and non-government commercial payers. And Zotec was a participant in providing that data along with some others, and we were recognized for helping. So one of the things that we get asked a lot in these meetings is, okay, well, you say that the health plans are not paying the No Surprises Act Independent Dispute Resolution Awards. Do you have any data? And we just released a study in April that showed that about 50% of the awards in 2025, almost 660,000 awards, had not been paid in accordance with the law. So it's helpful, we're able to hand them the study and kind of walk through it with them and show them the data. And I think that's going to be a huge future frontier for us, both at Zotec and as an industry, is being able to really gather up that data in a meaningful way and be responsive because the members respond to it. We did a survey through EDPMA back for 2024 data that was released in 25, and it was actually held up by one of the members of Congress during a hearing on the No Surprises Act. And he asked a representative of the health plans. He said, "Well, this survey says your members aren't paying the awards that are being determined in the No Surprises Act IDR process. How do you respond to that?" Of course, she said she hadn't seen the survey and needed to consult with her colleagues, etc.
Yeah.
So she totally avoided the question. But just the fact that he was holding up the document that we had prepared, it just shows you how powerful data is. And we have a lot of data in Zotec, and figuring out how to use it is going to be really, I think, the next frontier for us as we move into advocacy.
Okay. Well, that's all I have for you. It was nice to actually meet you one-on-one, not in a big Zoom meeting, for sure. Yeah.
Likewise.
Well, have a good one, and go USA, I guess.
Go USA. All right.
Of course,
Take care, man.
Take
We'll
care.
see
Have
ya.
a good one. Bye. Thank you for listening to Zotec Answers, and thanks to Ed Gaines for his insight about EDPMA's Hill Day. If you have topics you'd like us to cover, email us at zotecanswers@zotecpartners.com. That's zotecanswers@zotecpartners.com. Until next time, stay informed and stay engaged with your lawmakers. Thank you.